my speak will be about intensity of the repair of the cuff for traumatic and compare them with the degenerative tears with follow-up. As we know, every year in the world, more and more cuff repair are performing, and also the global rotator cuff repair reconstruction market is growing, so more and more money is putting into it. Also, we surgeons are doing more and more research every year, as you can see on a slide on your right. But unfortunately, the post-operative scores, the healing rate is a flat line. So this was one of the reasons why we decided to do a study where we randomly look at 300 patients operated between 2018 and 2020. We divide them into groups. For the final eligibility, we had 62 traumatic tears and 68 degenerative tears. We look at many risk factors according to other studies. We also heard today a lot about it today. Intraoperatively, we did a biopsy of the lateral part of the tendon, so lateral to the cable structure, and we analyzed it with the Bonner score. Then we did the repair, and we did the follow-up clinical and radiologically. Those were our research questions. So is there some difference in clinical improvement? What is the healing difference comparing traumatic and degenerative tear? Is some correlation between integrity of the repair and clinical outcome? And what is the correlation between tear size, fat infiltration, and healing? We use ultrasound for evaluation. The reason was it's logical, so you also can see it from this slide. The main reason for us was because it's cheaper, and because nowadays we have many MRIs that some of them are not of the best quality and we have to repeat it. For the integrity, we use a Sugaya classification, and as a tear, we considered 4th and 5th grade. Time from surgery, really interestingly, a long time from the comparison of the symptoms and surgery in both traumatic and degenerative group. The reason is because we work in public, and patients need long period before they can reach surgery, and most of all they tried, mostly of them, with conservative treatment prior to surgery. So now to answer to the first study question, if some difference in clinical improvement comparing two groups, not yet. So, but both subjective and objective clinical scores, you can see, increase significantly. Those results are comparable to all that we see already today. The second question, healing differences, low in both as expected. So from first two findings, from this finding and these findings, we can say that healing is not correlated to clinical outcome. So our results are comparable to all the other results we've heard today. For histological scores, we have two main scores. One is the Movin and the second is the Bonner one. We choose a Bonner score. Also Franceschi used it in one study in 2008. This score look at vascularity, at collagen fibers, at tenocytes, but however, the findings was really interesting. The degree of tendinopathy with Bonner score did not correlate with the gross appearance of the rotator cuff tendon, with patient outcomes, scores, or rotator cuff healing. So we were afraid that we make some mistake in our study or that we find something new. Then I start looking at small traumatic tears, so with less than 1 centimeters, and at tears where patient wait less than 6 months from start of the symptoms to the surgery, so to fresh small tears, and we saw that really high degeneration of the tendon. So even in small, fresh, traumatic tears, we have a high degeneration of the tendon. So one idea, what is the reason for that, is that traumatic tears do not exist, so everything is degenerated already. And the second theory is that after the trauma, you have some predisposition to go into degeneration, but there's no study regarding that. Our third question was return to pre-injury level, and we observed quite a low return to pre-injury level in both, so in degenerative tears and in traumatic one. Our explanation was that we face with high expectation of the patient, so even elderly patient want to do crazy things, so this was our explanation. Our last study questions, does preoperative tear size and fat infiltration influence healing rate? Firstly, we look at traumatic tears, and the answer is yes. So we look at tears bigger than 3 centimeters and degree of fat infiltration and compare it to all the patients in the same group. And we saw that the bigger is the tear size, the higher is the fat infiltration, and the lower is the healing rate. And in the degenerative tear, it's even more evident, this thing. So even higher fat infiltration in big traumatic and low, in traumatic, and lower healing was seen in the degenerative group. So in conclusion, operating traumatic and degenerative tears increase clinical outcome, and clinical outcome is not correlated to healing rate, so nothing new. Traumatic small tears have a high degeneration rate. This was a new finding, and we should consider them as a degenerated already. We don't know. A return to pre-injury level was lower comparing to other studies, and big degeneration in degenerative tears have highest fat infiltration and lowest healing rate, so we probably should not operate them. Thank you for your attention.